Funding for the production of Public Square provided by the W.K. Kellogg Foundation, working to improve the lives of vulnerable children.
This program is part of American Graduate. Let's make it happen. A public media initiative made possible by the Corporation for Public Broadcasting.
And Ken Burns presents Cancer, the Emperor of All Maladies, a film by Barack Goodman, is made possible by project supporters Genentech, Cancer Treatment Centers of America, Siemens, David H. Koch, Bristol Myers Squibb, the Alfred P. Sloan Foundation, Kovler Fund, the Arthur Vining Davis Foundations, the American Association for Cancer Research, the American Cancer Society, the Leukemia and Lymphoma Society, the Entertainment Industry Foundation, Stand Up to Cancer, the Corporation for Public Broadcasting, and PBS.
We think it shouldn't happen to us Pueblo Indians. It's not going to come into our communities, but it's all over. Cancer doesn't pick a person.
Of course you want to have great communications with your doctor and trust with your doctor, no matter where you're at. And part of that trust is if the doctor looks like you.
It's not just screening we're talking about, it's provision of care quickly and appropriate care, culturally competent care.
So a PAP test, something that you can go into a facility and they can do very simply, that you can get. But if you need a colonoscopy, you better get in line.
They can't afford the medicines you prescribed. You sent them to a place that has no interpreters. Could you change this?
I turned around, opened the door, walked to the door and opened it, and it says, "Bye, cancer, out." And I turned around and says, wow, healing is starting right now.
I hope everybody can open their heart and say, these people really need help.
Welcome to Public Square, where civic dialogue takes center stage.
To have women that look like them, talk like them, come from that same culture, in our case, we find that it opens up that discussion so that we're able to understand what really are those things that keep us from, getting screened or even going to see a doctor.
Cancer, it used to be a death sentence, and many feared even talking about it. That has changed drastically in the last few decades, at least in mainstream America. But what about in our diverse communities in New Mexico? The number of cases for many common cancers are still higher among the Anglo population than the Hispanic or Native communities, and yet screening rates in these communities tend to be lower. Thus, it's common for cancer to be detected at later stages. That, along with other factors, leads to lower survival rates. Also, certain types of cancer are actually higher among these groups, such as colon cancer in Hispanics and cancer of the gallbladder and kidney in Native Americans. What are the challenges to talking about cancer in Hispanic and Native communities? Why aren't people getting earlier screenings? What role does access to care play? And how can we change these outcomes in New Mexico? We'll answer those important questions and more with a very candid and often heartfelt discussion with Hispanic and Native survivors, advocates, and health workers, as well as data experts. And we'll talk about solutions with Joaquin Baca and Dr. Art Kaufman of the University of New Mexico. Before we start, here's a little more information on our topic.
Gloria has an appointment with a nutritionist because she was in a clinical trials.
It looks like you've got a history of breast cancer.
Yes.
Is that correct?
Yes.
All right. And when was the initial diagnosis made?
She has been diagnosed with a fatty liver. So they are taking her off the clinical trials. She just needs to visit with a nutritionist to kind of help her how she can help herself.
The recommendations for breast cancer are a more plant-based diet. So we'll be talking about that today. Okay. And we'll also
Dalila, talk about what you do as a patient navigator.
When I first meet them here, we kind of sit, I visit, and I let them, I tell them about my journey and the things that I'd have to do, the surgery, the chemo, radiation, taking tamoxifen for 5 years. So by me sharing my story with them, it kind of gives them an idea more or less what they're going to be going through. Just them knowing that there's someone here that has been there. And that kind of relieves a little bit of the stress.
And Carmen Gloria, why is it important for you to have Dalila here with you?
It is really important because Dalila has been in my journey since I started with breast cancer. Sometimes when we are with doctor, we get kind of worried, so sometimes we don't take or we don't understand what they are saying to us, so Dalila is here to support me and help me. So now I've been switched to another hormone. It's Arimidex.
Yeah, she'll be starting Arimidex. She's also doing the injection every 28 days. It's a new regimen that Dr. Royce has prescribed to her.
Okay.
One of the things we'll be talking about in the show is how patient navigators can help bridge the divide between big institutions like this and communities like Native Pueblos or Latino Hispanic communities. Can you talk about that?
There is that language barrier, so we have to bust that down, and we get interpreters in here to interpret it, because you say one thing wrong in medical terminology in Spanish, it can mean something totally different. So people start getting worried, if you're saying it right. So that's why we get interpreters involved, medical interpreters. That way they're saying the right things as it's coming out of the doctor's mouth.
And what has been the reaction of the doctors? Do they welcome navigators?
They're very much so, yes. At least here at our facility, yes. Actually, and a lot of our doctors that have come from different facilities, they're used to having navigators on board. Once they order an X-ray or a CT scan, we make sure that's scheduled and it's done in a timely manner before their next pending appointment with that doctor. So yes, it's very, very welcome to the doctors.
Why is it important that she's Latina, that she comes from your community?
It's everything, because it's somebody for my culture, so she will understand the way that I will feel sometimes. She will know why I feel that way. The trust comes there also, because she speaks my language, she knows my culture, both are Latina, she will know exactly how I would feel.
I want people in the community, especially Native American people in the community, to see that we have survivors of cancer out there. It's something that we don't talk about a lot in our Native communities, and so knowing that we have survivors, knowing that cancer is a survivable disease is really important.
We don't make wills because don't do your will. You're only hurrying death. And it's the same thing with cancer. Don't talk about cancer. You might get it, Just leave well enough alone. Don't bring it on. Those are the myths, and we need to steer it in the other direction.
It's real important to put some perspective on some of the barriers that in our community exist, not just cultural issues, but also looking at healthcare system barriers and how we can improve the care for our community.
If we don't address the opportunities and take advantage of the opportunities for prevention, we may see the cancer burden in Native populations in New Mexico fail to improve or even perhaps worsen.